So after I've checked the baby's pelvis, one of the other things that I think is really important to check is the flexibility of the upper back. So when a baby is face down, it will start to pick up its head. And this is a really good thing, because when a baby is doing tummy time, a lot of these upper back muscles attach to the occipital bone. And if the occipital bone is a little bit crooked, when they contract that muscle, it helps to pull and align that bone. So often one of the exercises that I will give to mothers is, do tummy time 6 times a day if I've been shaping the baby's head. Now I know a lot of mothers worry about baby being face down. There was a time all babies actually went on their tummy. And if you actually look at the way a baby's face is designed, and the way the nose is, even when it's breastfeeding, no matter what's smashed into the baby's face, it can still breathe. So if you're worried, you can take a towel roll and put it under the baby's chest to keep it up a little bit. It doesn't have to be that high. But you can, if you're worried about that, they should be able to, there's nothing blocking, they should be able to pick up their head. And this is normal. So one of the reasons I check the baby's upper back is because a lot of the times, so these are all the ribs along here. This is the thoracic spine where the ribs attach. This can be restricted and stuck in a forward bent position, so that now the baby can't pick its upper back or pick its head up off the floor or whatever it's lying on. So, and this is, I'm showing you on a doll, but this is actually normal range for a baby. They should be able to do this very easily. And so when I see a baby that's not being able to pick its head up or move very well, I always check its upper back. I do some very gentle adjustments to get this area moving, and they'll start being able to pick up their head off from a prone position or tummy time. So that's, I think, really important. The other thing that I check for is I make sure they have full range of motion of the neck, both in rotation, side bending. Sometimes, as I said, I have to release the cranial base, the occiput, off the first vertebra. And there's some gentle little adjustments that I can make working with the soft tissue. Very, very gentle. And we can get full range of motion very quickly. I would say majority of the cases are really simple. Some babies that I see who maybe they have had torticollis, it's been 6 months. This muscle might already have a lot of adhesions that can be quite challenging to try and correct it at that age, which is why I encourage you, if you see these asymmetries in your baby, to find a professional with experience to correct them as soon as possible, because it gets harder as you get older. So going back to what I said before briefly, lie the baby down, make sure your baby is straight, arms and legs straight. Also make sure that they're symmetrical in their movements, kicking, moving their arms, not everything just one-sided. Head is straight. When it turn the baby over, you got to take a look at their bum. Make sure these bones down here is level. Make sure this crease is level or straight down the middle, not off to one side. Because again, these bones all rotate, and this will affect the baby when they have to creep and then crawl. So they're not able to move as well. It's no different than an adult. If you hurt your leg and it's twisted and rotated, you're going to find that sometimes it's not so easy to do whatever sport you want to do. Well, a baby's going to have a hard time, creeping and then crawling if the pelvis is not perfectly aligned. So we want to make sure the upper back, we want to make sure their neck has full range of motion. And sometimes the mother will notice, because when she's breastfeeding, if the baby's head's only turned in one direction and she tries to breastfeed and she can't get the baby to feed on the other side because the neck is hurting, that's quite significant, because one, she could end up with blocked milk ducts. That's not going to be comfortable. She gets mastitis because the baby's not sucking from that side. But also, just as more importantly, the baby should be able to turn its head freely in both directions.